Hey Jacqueline, I'm Caitlin. How are you?
Hi, I'm all right. How are you?
I'm good. So, as you know, I work with Simpson County HIV Clinic, and I know that you have been referred to us. So, the first thing that we're going to do today is some just housekeeping paperwork, if you don't mind.
That's fine.
Okay, so since we're meeting virtually, I'm just going to go over the policies and procedures, and I'll take record of your consent.
Okay.
Okay, so the first is confidentiality. Anything that you share with me today is between you and I and the agency, unless you give me implicit consent to share it.
Okay.
Okay, perfect. And just so you know, I'm taking notes of all this. Is that okay?
That's fine.
Okay, perfect. And the only way that I would breach confidentiality is if you were a threat to yourself or others, or if I suspected abuse of children or child neglect or abuse of any other population.
Okay.
Okay. And since we are virtual, do I have consent to record this session?
Yes.
Okay, perfect. Thank you. Okay, so in your own words, can you tell me what's brought you here today?
Yeah, I had to go to the hospital and they did a STD panel on me and it came up positive for HIV.
Okay, do you mind telling me what led you to go into the hospital for that type of test?
Yeah, I was raped a couple weeks ago and afterwards I went to the hospital just to get like the rape kit done for evidence or anything like that. And I didn't know they would do an STD panel, but they said that it was best if they did one. And obviously, I'm glad now, in hindsight, that they did because they told me I was positive for HIV, but I was negative for everything else that they were able to test for at that time.
Okay, good. Okay, at the hospital, were you prescribed any medications to treat HIV at that point?
No,
Okay.
they told me that I should come here for something like that. I'm not really sure why, but that's what they said.
Okay. Well, we certainly will help you, so I'm glad that they referred you here. Okay. Do you mind during your interview today, we're going to do a little bit of pre-counseling and post-counseling, and we'll go over what all we can do for you at the very end. Um, do you mind to tell me a little bit about what happened?
No, I don't mind. I was over at a friend's house and we were having some drinks and I only had like two drinks, but like on my third one, all of a sudden I started getting really woozy and then I just blacked out. And when I woke up, I was naked and there was a strange man in the bed with me. And when I woke him up to say, like, who are you? He just like ran out of the room. And I don't know who he was. I never saw him before. He may have been at my friend's house, but there was like 50 people there. So I don't know. Maybe he was already there. I don't know. So I don't know exactly what happened. But then when I went to the hospital, they were able to find like evidence that I was fully raped. So they were able to get the evidence, and I guess the police are working right now to try to match the DNA with whoever that man was. Um, but yeah, when I woke up, I just like went immediately to the hospital.
Okay, that was good on your part, and you did not know your perpetrator.
No, I didn't know him beforehand.
Okay,
No. If I saw him again today, I would recognize him just because I saw him in the morning, but no, I didn't know him before.
okay.
They also said at the hospital that there was evidence that I don't, I don't remember what they called it, Rohypnol or something like that. They said I was roofied. So that was
Right,
why I blacked out after like two drinks.
right, that makes sense. That's actually pretty common. in situations like that, it's a surefire way to make a victim not remember.
Yeah.
So I'm very sorry to hear that, and I'm thankful that you were comfortable enough to tell me a little bit about what happened. So was your experience at the hospital helpful? Did they try to link you with any kind of counseling? Have you been counseled or anything?
Honestly, I don't feel like my experience at the hospital was that great.
Okay.
It felt really invasive. And like, I know that they were just doing their jobs and they were nice, but it didn't really seem like an environment where I could start healing. I don't think that that was really their, priority for me. It was just like, get the evidence, do an STD test, and now you're positive, go see these people at the public health clinic and bye.
Okay.
So they didn't link me with any counselors or anything like that.
Okay. All right. Well, that's good to know, even though it could have been a better outcome. It's good to know we can definitely help you out there.
Good.
So because the rape happened 2 weeks ago, there's a window period. So even though your test was positive, we would prefer and suggest that you get a confirmatory test within 3 months of the assault. And that's just to confirm that you're positive and your body has produced antibodies against the HIV virus. So we will make a appointment. That would be 3 months from the assault. So since it was 2 weeks ago, we'll make it for 3 months from that day around. So I'll get that in the works, just to give you peace of mind that you are working towards immunity and getting your immune system responsive to the virus. And obviously, we have medications here, and we have practitioners, doctors, nurses, all kinds of staff that are well equipped to handle your treatment. Is that something that you're interested in?
Yeah, definitely.
Okay.
I don't have health insurance, so I don't have like a primary doctor. So for my AIDS treatment, can I just see you guys all the time?
For sure. Yes. And we also have like case managers, medical case managers, and they are great about helping people get health insurance. So the medication out of pocket cost is pretty expensive for these drugs. And our medical case managers are fantastic about finding insurances that are suitable for our clients. So we will also help you get insurance.
Okay, that'd be great.
So I'll put that on our to-do list. And one thing that you said is AIDS treatment. So our goal here at our clinic is to help you not get to the AIDS stage. And I'll get more into detail about that later, but there are stages of HIV. One is the acute period, which you would technically be in right now. It's the first 2 to 4 weeks of after exposure. That's when your body is trying its hardest to fight off the virus. And then there's the chronic stage, which can be up to 15 years. That's when you're just living with it. You're not having a whole lot of symptoms. You're treating it. And then AIDS is when your body has just fought and fought and fought. And then you eventually get a co-infection, which means that you have HIV and also another infection like cancer, tuberculosis, etc. And our goal at the clinic is to have you so well medicated with HIV treatment drugs that you never reach AIDS. So I hope that you, at the end of our session, working with us, that you have hope that you will never get to AIDS.
That sounds great. I didn't know that that was possible, so I'm excited for that.
Yes, HIV treatment has come a long way. Okay, we need to get insurance. Okay. So our to-do list is get insurance and make an appointment for approximately 10 weeks. That would give the 2-week deficit for when the assault happened. And get you linked to one of our counselors. Would that be something that you were interested in?
Yeah.
Okay. Okay, and then I'm going to ask a little bit about your demographics, little personal information, just to get to know you. If you're going to be a client of ours, we take pride in knowing our clients. You're not just a number here. We try to help you the best that we can in being who you are all the time. So, do you have a partner, a significant other?
I do. I have a boyfriend. His name is
Okay.
John. I've been with him for many years, but he's really been struggling after this rape happened. Um, so I'm not really sure if we're going to keep being together, but as of right now, we are together.
Okay. Does he know your status?
He does.
Okay. Okay. Well, we can also include him if you choose with the counseling. We offer partner counseling to help partners of those living with HIV and how they might handle it, how they would cope, and how they can live their lives with their partners living with HIV in a happy, healthy manner.
Okay.
Would you like that?
That would be great. I think that'd be great for us because we're both really struggling with this.
That's understandable for sure. It's a major shock, especially when HIV comes from an experience that was obviously unforeseen and in no fault of your own. So it's understandable that it's shocking and hard to swallow right now, but there are lots of chances to grow.
And I think that that's where he's really like misunderstanding is that I don't think he really understands that it was non-consensual or not my fault, as you said. So maybe through counseling, I can help him like understand that it wasn't like I cheated on him, which is kind of how he sees it or how he feels at least.
That's understandable. And our case managers, I'm sure, would be able to find support groups for those partners whose other significant others have been through rapes or sexual trauma. That might also benefit him if he's willing to attend support groups. Um, I'm sure that our case managers would be happy to look up resources for him.
Okay, that'd be great. Thank you.
Okay, I'll work on a to-do list for John as well. Okay, so tell me a little bit about yourself outside of HIV and outside of your trauma.
So, oh, where do I start?
How old are you?
I'm 32
Okay,
and I don't have any kids. I was working before the pandemic, but then I lost my job and I've had a roommate, but recently she kicked me out because I told her about the HIV and she was scared about like catching it, I guess, living together. So she kicked me out, but since I don't have a job, I'm having a hard time finding another place. So the last few nights I've just been like sleeping in my car.
okay. Okay, well, that told me a lot actually. So you're 32, you're in otherwise good health, it appears.
Yes.
So with HIV medicine and treatment, you should expect to live a long, healthy life. I want you to know that first and foremost. HIV is not a death sentence. It's very manageable. In fact, there's celebrities with HIV who use their platform to speak on their happiness and their health. If you know Magic Johnson, he is a huge star that has HIV. Um, you don't have kids. And if you ever want resources about if you're able to have children with HIV, absolutely you can. And we can give you resources about how to go about pregnancy and all like birth plans and things like that. If that's ever a topic you want to discuss, you're welcome to reach out. Um, and if you don't have a job, but you would like a job, we're very much able to help you look for jobs. We want our clients to be able to come to us for things outside of HIV related. So if you're struggling with anything, we're here to help you. So if you need us to help you with resumes or job searches or job fairs, we're happy to help you with that. Just let me know. And then we also have housing programs. So because of your positive status and the fact that I'm going to enroll you in care with our clinic, you'll be eligible for housing. And John can come with you. So this is a grant funded program where our patients living with HIV, we know that living with HIV can get expensive, especially if you're paying out of pocket for medical visits, medication, transportation to and from appointments, just all these things pile up. We understand that. So we actually get funds and grants to be able to house our patients if they need it. So I will definitely put you on the list to be assessed for housing.
How quickly could that happen?
There's no definite answer on how quickly you'll move. Like I could not give you a move date, but your assessment will happen within a week. So our housing coordinator will get with you within a week. She'll go over like how much, I don't have, for lack of better terms, your budget, how much we're able to fund on a place, and you're welcome to get a place that costs more than we can fund and make up the difference, or you're welcome to use all of our funds and find a place that we can fully fund. And like I said, John is welcome to come with you. It does not have to be just you because you're HIV positive. He's welcome to come with you. And we pay for rent or mortgage, whatever applies in the situation. We pay for that. We pay for utilities, water, all the things that would constitute as a housing expense. So that would be a program that I'm going to assess you for within a week.
Do you have any idea where I could stay until then?
I do actually. So we have emergency shelter. We kind of have like a contract slash agreement with a local hotel. It's not permanent solution, obviously, but it's better than you having to sleep in your car. So we work with a local hotel and they take in our patients, and we pay a discounted rate for our patients to stay there until we can get them into housing. So for right now, if you're interested in that, effective tonight through however long it takes us to get you into a house or an apartment, you and John can stay at the hotel.
That would be amazing. That's great.
Okay. The only caveat for the hotel is they don't allow pets. Do you have any pets?
No, I don't.
Okay. If you did, we would just have to pay, and we would fund it. We would just have to pay for them to be boarded until we got you a house. Okay. So I've got a little bit of information from you. I feel like we've made a pretty good dent in what you need and where we can go from here. Are you able to come in tomorrow for a confirmatory test just to follow up from the hospital before we set the window period test?
Yes,
Okay. Would 10 a.m. work for you?
that's fine.
Okay, and I'm not sure what type of they used at the hospital, but ours here are just really easy, really simple. It's a 60-second test. So as quickly as I can stick your finger and get just a little drop of blood into our little pipette, it takes 60 seconds to give you a result. And assuming that you already know your result, it's just to confirm in our system that we ran our test and it came back with the result that we were expecting. And that will be the last step that I need before I can officially enroll you as a patient. And then after I do that, like I said, you'll be welcome to stay in the hotel. You'll stay there tonight too, as well. You just won't be enrolled in our system until after tomorrow's test. But then after that, you'll be assessed for housing. I'll get you linked to a mental health counselor. Would you prefer male or female?
I think I prefer female, especially if I'm going to be talking about what happened to me. I think it'd just be easier to talk to a woman about it.
Sure. Okay, and then we're gonna make you a appointment for 10 weeks out. That's to follow up on your window period of 3 months. So approximately 10 weeks would give us the 3-month period that we need. And we're also gonna get a case manager to find an insurance program that is suitable for you. Is there anything else that you had ideas about or questions about, or it stuck out to you that you might want from us?
No, I guess if the case manager could also work with me on finding a job, I'm a little worried about that. Just
Okay.
been feeling pretty depressed and like tired. So I'm not really sure. Maybe I just need a couple weeks to recover, but I really would like to get back to working.
Okay, for sure. Yeah, that one was totally optional. We don't require you to have a job, but that option was there for you to take if you wanted it. So I will definitely have a case manager add that to their to-do list for you. And then treatment. So your treatment isn't contingent upon health insurance by any means. We don't make you have that before we'll give you medicine. We're not like that here. So as soon as we get you in for your test tomorrow and we get your results, we will see your results and we're sure it's going to be positive. So we will anticipate having a provider here at 10 a.m. tomorrow to prescribe you one of the several HIV drugs. And that treatment will start immediately. And we will, after your test tomorrow, we will go more in depth about adhering to treatment and making sure that you take your medicine, how it's supposed to be taken, and what the medicine will do for you. If you take your medicine how it's prescribed like it should, eventually your body will be boosted so much that your HIV will be undetectable. It will be so suppressed that your body will not be able to detect it. And that is what makes you makes you live a happy, healthy life. So after your test tomorrow, I'll have a provider here for you to prescribe that, and you'll get meds immediately.
That's good.
Okay. Is there anything else that you had questions about, concerns about?
No, I think that's it.
All right. Well, then I'll be here and I'll see you at 10. I'll talk to you before your test and just ease any fears that you may have before doing it. I know that you've been through one before, but it still may bring up some feelings that you want to talk about, or you may just want someone familiar there with you while you do it. So I'll see you here at 10 and we will see how tomorrow goes and we will get you linked to care.
Okay, thank you so much.
You're very welcome and give me a call anytime today if you have any more questions.
Okay, will do.
All right, see you in the morning.
Thank you.
You're welcome.
Bye.
Bye.